Good afternoon, and thank you for joining us at today's coronavirus press briefing. I'm Caroline James in for Donna Bush. Welcome to our viewers on CIGTV, YouTube, Facebook, and our listeners on Radio Cayman. We begin today with a prayer from Dr. PJ Lawrence.
Holy God, we come before your presence. We praise your holy name. You are our Creator, Redeemer, Healer, and Helper. We thank you for your protection during COVID-19 pandemic. Thank you for our leaders who are doing an outstanding task in keeping the islands safe. We pray for our leaders and health workers. We pray for the eradication of COVID-19. We pray for your protection from hurricanes. We pray for all the residents that we may continue to cooperate and keep praying for all people and nations and the whole of creation. In Jesus' name we pray. Amen.
We welcome our panellists this afternoon, His Excellency the Governor, the Honourable Premier, the Honourable Minister for Health. In the room with us, we also have the Chief Medical Officer and the Director of Hazard Management, along with our sign language interpreter, Miss Carolyn Powell. We also welcome our members of the media, our members from the Compass, the CNS and Radio Cayman, along with the Medical Officer of Health. Let's turn first to Dr. Lee for his update.
Good afternoon. I have 316 results to give today, which all of them are negative since yesterday's release. So our total remains at 201 people who've been positive in the Cayman Islands, with 3 of those being on Cayman Brac. There are no symptomatic people, 6 asymptomatic people, no one is admitted, and 194 have recovered. There are 63 people in the government isolation facilities and 23 people on home isolation. In the last 24 hours, there have been 5 people seen at the flu clinic, of which 3 had mild flu-like symptoms, and 13 calls to the flu hotline, of which 1 was flu-related. Mentioning testing, you'll probably have noticed that the testing numbers have dropped a little, especially over the last week. We're continuing to call and ask people to come for testing, but they are not necessarily inclined to come. So I would please encourage you, if you are called, to please present for testing. It's really important that we continue to screen the population to make sure there has been no outbreaks that we could potentially put a stop to. So I would appreciate your consideration of that. As far as the antibody testing is concerned, we have done 994 antibody tests, of which around 1/3 of these have been done at the Health Service Authority. Sorry, beg your pardon, 2/3 at Health Service Authority and 1/3 at Health City. Of those, we have been calling forward a lot of people who were PCR positive previously, as well as doing a lot of healthcare staff. And so this is not a sample that's representative of the population. There will be more people that are positive in this group that we've called forward, these 994. There have been 41 people who are positive for the antibody test, of which 33 were known to have been positive with the PCR test. There were 3 further that were contacts of people who were previously positive on the PCR test. 5 people had no history of being positive on PCR. Additionally, there is somewhat confusing but nevertheless reported widely elsewhere, 9 people who are negative for the antibody test who had previously been positive for PCR. That's around 20%. And we know that that has happened. There are a number of reasons for that. One possibly being that you don't mount an antibody response. 2 is that your antibody response is mounted, but there's subsequently you can no longer detect the immunoglobulin G that we're looking for. And 3, that the test has not been sensitive enough to pick up that particular antigen that's in the blood for that test. I've previously talked about how the antibody tests are each one between some of them there are differences, and I've talked previously as well that some look for the nuclear protein and some look for the spike protein, and there are different sensitivities looking for those two different proteins. Overall, that gives a 4.1% positive rate, but as I mentioned, this is not a sample that's representative of the general population. It's already a selected sample where we're likely to have a higher rate. But as previously described, the rate of people who are antibody positive is exceedingly low, which suggests that COVID has not been as rife as we might have thought amongst the population. And in fact, this is much in line with many other countries finding the same, that even though there is a significant disease rate, it hasn't actually spread that far into the community, despite the fact it's giving a lot of sickness and unfortunately deaths as well. Thank you.
Thank you, Dr. Lee. I know we have questions from members of the media. Caymanian Times, Mr. Ralph Lewis, I'm sorry I missed you out the introduction earlier. You can go first with your question for Dr. Lee.
Good afternoon, Dr. Lee. Hope you had a good week, and thank you for your presentation. I have two brief questions. The first one is about the number of tested cases. Of the 24,000 tested cases, are they all separate individuals, or there are some that have been repeated from individuals?
I think that's previously been reported. There are repeats because as we go back round to test, we are doing certain groups repeatedly. So, for example, healthcare, nursing homes, the prisons, and so on, frontline workers are having repeated tests, so that it doesn't represent individual people. Some people are being tested multiple times.
Okay, so I think can you give an idea of how much individuals have been tested?
I don't have those results written down on my piece of paper here today. I think the Cayman News Service reported that around a week ago because they asked for the figures and I provided it to them. I have a feeling it was somewhere in the region of, well, I think the figure that I gave them was something like 10% of them were repeat tests, so 90% were individual, but I'd have to go back to look at those figures.
Okay, thank you. The second question is, have all the Cayman Brac cases been resolved or recovered?
The Cayman Brac?
Yeah, have all the positive cases in Cayman Brac recovered?
Yes, a long while ago, yes.
Long while ago. Okay, so the Cayman Brac is virus-free?
We hope so, yes, we believe so.
Okay, that's it for me for today. Thanks, Caroline.
Thank you very much, Ralph. We have questions from other members of the media. We'll go to Wendy at CNS.
Thanks, Caroline. Hello, Dr. Lee.
Good afternoon.
Can I just check? You said that 9 people who were PCR positive were negative for the antibodies. Is there have you been recording dates? So, for example, perhaps they were people that were tested very early on, which may give some indication as to the fact that antibodies fade away, perhaps. I don't know. I just wonder whether you had any timelines on when those people were tested.
I don't really have the details that you're seeking, Wendy. I'm sorry.
Okay, can I send a question and ask some of these?
Please
I've got a few more that are a bit like that.
Please send it to the Government Information Service and they'll do their best to answer.
Okay, great. Thank you. Also, you were talking about people not turning up for tests. Is there a specific group or sample group that you're doing at the moment? And also, has there been consideration to just simply opening it up to all?
In fact, on the gov.ky/coronavirus site, it is possible for anybody to register through that site to get tested now.
Okay.
So we would be keen for people to come forward in order to continue to manage the screening program at this time.
Okay, lovely. Thank you. That's all I have.
Thank you, Wendy. Kayla at the Cayman Compass, if you can hear me, go ahead with your question.
Oh, I don't have any questions for Dr. Lee. I'll wait for the panel.
Okay. In which case, we will hand over to our panelists, and we'll turn first to the Honourable Premier.
Thank you, Caroline. Happy Friday, everyone. It's been a week since the last press briefing, and during that time, we've continued with our aggressive testing program and have seen more than 1,600 tests carried out with very low positive results, and those that have tested positive have all been asymptomatic. This is excellent news as we continue to reopen our economy and society. Our plan has always been to wait at least 2 weeks between reopening phases to see what the effects of each reopening have on our community. It has now been 2 weeks since we ended all curfews, saw more people returning to the workforce, increased the number of persons who can gather to 25, reopened our churches, cinemas, theaters, and beauty salons. While for the time being we remain at level 2 minimal suppression, I'm very comfortable moving to the next reopening changes that will come into effect on Sunday, 5th July. These are educational institutions and facilities, including summer camps and vacation Bible schools. All these may commence full operation, including social and sporting activities. However, I should just note that sporting activities do not include contact sports, which are planned to start on the 19th. In Grand Cayman and Cayman Brac, restaurants and bars will be able to offer both indoor and outdoor services. Each table can now be 6 feet apart. Persons at a table can now be seated 3 feet apart. That is, persons who are not members of the same household. Servers and front of house staff must continue to wear masks or cloth face coverings while serving customers. Persons will be able to exercise in a strata gym and public gym from Sunday, and my 2 sons will now finally leave me alone on that point. Persons wishing to travel from Grand Cayman to the Sister Islands prior to traveling must notify the medical office of health of the proposed travel and be tested for the virus. Again, persons are reminded that they will only be permitted to travel to the Sister Islands after receiving test results which have been declared to be negative by the medical officer of health. Some good news for our students, parents, and others who will be traveling over the summer direct from Cayman to the UK. The UK government has announced today that there will be no need to quarantine once you land. Very grateful to the governor and all the others who have lobbied so hard on behalf of the overseas territories. All 14 British overseas territories have been exempted from quarantine in the UK. I'd like to thank Andre Ebanks, our representative in the Cayman Islands Government Office in London, and his colleagues as well for the job that they have done in helping to lobby the UK government for this exemption. The Governor will shortly speak to the 72nd anniversary of the UK's National Health Service and the stellar work they are doing to save lives. I will not steal his thunder, but I do wish to recognize the Caymanians who I understand work in the NHS in the UK. A 2017 NHS study reported that there were some 40 Caymanians who were working in the National Health Service in the UK. So if you're a Caymanian working in the NHS or know of Caymanians working there, please encourage them to get in touch with us by emailing info.cgo@gov.ky or via our website www.caymanconnection.org so we can personally thank them for their hard work and dedication. And travel time, I'd just like to remind everyone that travel time went live on Wednesday, 1st July. Other than those traveling to the UK, anyone wishing to travel to, from, or within the Cayman Islands, whether by air or sea, are asked to reconfirm their intentions and desire to travel at www.exploregov.ky/travel time. Those who are traveling to or from the UK will continue to do so through the Governor's office. The travel time team is actively working on repatriation flights. Flights currently scheduled include 3 flights to Kingston, Jamaica on the 4th, the 9th, and the 11th of July, and 2 flights to Miami on the 8th and 10th. And there's a flight to London, another flight to London on the 31st of July. I would add that there were 2 flights that left from Miami today as well as a flight through London for persons returning to India. I'd like to give an update on the government's program supporting businesses, and in particular the Micro and Small Business Grant Program. The Cayman Islands Center for Business Development, under the Ministry of Commerce, Planning and Infrastructure, began accepting applications for grants to the micro and small business sector in April. To date, 950 applications have been received. $1,076,000 have been paid to applicants, with a further $414,000 approved for payment. Of the 950 applications received, 84% have been processed, with 178 business owners receiving full payment of $3,000. Based on the number of approved applications, the total funds so far committed by the government to the program is $2.6 million. With a 97% application approval rate, the Micro and Small Grant Program has sought to ensure that all businesses that meet the criteria are given access to these funds. The Center is now moving to introduce a digital application form which will be rolled out later this month. The Low Interest Loan Program. There have been 65 applications for participation in this program, with a total value of $2,221,000. 5 have so far been approved, with another 5 currently being assessed for approval. The total value of loans at the approval stage is $415,000. For the benefit of those applicants who are unable to adequately present their financials to the bank, the government has also implemented a technical assistance program where qualified accountants have been employed to help prepare these documents at no cost to the small business owners. This program has so far worked with 32 loan applicants, helping them prepare their financial statements and business plans. The Center has conducted 5 training webinars over the period, with 350 persons in attendance. Business advisors at the Center will now move to introduce small group trainings based on an assessed need, with primary focus on helping small businesses to pivot in the current business environment. Entrepreneurs, micro and small business owners interested in support should contact the Center for Business Development at 244-8009 or via email at cicbd@gov.ky. I want to commend the team at the Center for their tremendous work at this time, and we are delighted that although it's been slow initially, the take-up is now starting to really move along. And I want to conclude this part of the briefing with a shout out to Miss Miriam Williams, who will be 80 years tomorrow, 4th of July. Happy birthday, Miss Miriam. Hope you have a wonderful day.
Okay, thank you very much. Good afternoon, everybody. It's a pleasure to be back with you all again. I agree that the test results remain extremely encouraging, and we have no major cause for concern as we make further relaxations under suppression level 2. And I think it does confirm that we have successfully shielded ourselves from the pandemic, which sadly across the world is accelerating. We have 10 million cases, 500,000 deaths, and I was struck by the fact that 60% of those cases have appeared in the last 30 days. And clearly the situation in our closest neighbor remains worrying in the US, and we're watching that very carefully. I think it's also worth saying that countries that have dealt with this pandemic successfully, like Cayman, have done 3 things really well. One is clear, calm, and compassionate leadership. The second is strong public health systems with increased capacity to respond, and we've really done that very well with our testing, the isolating cases of contacts as well, and all of that based on good science with strong input from our Chief Medical Officer. And then I think the third thing is individual responsibility and all of society participation in the social distancing, the basic hygiene, and wearing masks in public. And I think everybody is making a big effort to keep that going. I think it's worth saying that COVID is, it remains a marathon. It's not going to be a sprint. It is going to be with us for the foreseeable future. We have to live with it until we get a vaccine. It's encouraging. There are 17 vaccine trials underway, and Oxford University in the UK remains the most advanced. But all of us will need to transition from what I would call an understandable state of anxiety to empowering each other to adopt the essential prevention measures, the social distancing, the basic hygiene, wearing masks in public. We all need to be disciplined about those because they keep each of us safe and they'll keep our community safe. And I thank everyone again for their cooperation. On quarantine in the UK, Premier has referred to that. I think this is really good news, and I'm delighted that Cayman is included in the list of countries and territories whose citizens do not need to self-isolate for 14 days on arrival in the UK. And as the Premier said, for our students and families who are going to the UK, that is excellent news. It is just worth saying that that is not, of course, reciprocal. So anybody coming here from the UK will be required to go into the government isolation facilities for 14 days. On evacuation flights, today's India flight, as the Premier also mentioned, has gone ahead as planned. Over 270 Indian nationals are going home on that flight today, and about 50 people, compassionate humanitarian cases, going back to London from here as well. It's been a fantastic Team Cayman effort, but I do pay tribute to the small team in my office who've had to work incredibly hard on this flight, which has been probably the most challenging we've had to do, dealing with the Indian authorities, dealing with Qatar Airways and British Airways, and some very last-minute issues to sort out with UK Border Force. But I'm pleased to say everything is going ahead. And I would also just like to clarify that my office and the new travel time team will be working closely together on the BA Airbridge flights to and from London until the end of August. And as I've previously announced, my office is planning to run flights on the 31st of July and the 28th of August to enable students to travel to the UK to commence their studies next term. Now, we've already been in touch with those students who have previously expressed an interest in these flights, either via the emergency travel line or via a large group of students who are being coordinated by Mrs. Carolina Claiborne. So these passengers will be contacted directly by staff in my office once booking commences, and they do not need to register again. But if you are a student or family travelling with a student via these BA flights and have not received an email this week, please send details of passengers and your preferred flight option, 31 July or 28 August, and confirmation of your acceptance from your school or university to ukstudenttravel@gov.ky, ukstudenttravel@gov.ky. That is set up just for these BA flights. And travel time continues to lead on all other flights, as the Premier said, including for students going to the US and Canada. And travel time continues to lead on the isolation facilities and in terms of who can come back to our islands. But I do want to just point out, if passengers wish to return to the Cayman Islands on the two BA Airbridge flights, you now need to register with www.explore.gov.ky/travel time. The Premier mentioned the NHS, so I don't think I need to say too much on that, but let me just say that on Sunday, the 5th, it's the 72nd anniversary of the NHS social care system in the UK, a truly beloved institution. And we just want to say a thank you to the Caymanians who work in the NHS. We do believe there are about 40 of them. So on behalf of the UK, let me thank them for the contribution they have made to what has been an extremely difficult situation in the UK managing COVID. And then finally, I just want to wish everyone a happy Constitution Day on tomorrow, but we obviously have the public holiday on Monday. Last year, Celebrate Cayman did a fantastic job celebrating the 60th anniversary. It will be a little bit more muted this year, but no less important. And I believe Cayman enjoys an extensive degree of self-government and has a really strong, mature and constructive relationship with the UK, thanks in great part to the pivotal role the Premier has played in that in recent years. And I think that is something we can celebrate on Constitution Day. And I wish everyone a long weekend. Thank you.
Mr. Seymour.
Thank you, Caroline. Good afternoon, everyone. Happy long weekend. Grand Cayman, Cayman Brac, Little Cayman, and our Caymanians overseas listening in as we celebrate on Monday, our Constitution Day, as mentioned, which commemorates our passing of the first Constitution back in July 4th, 1959. Scripture reading today is from Psalms 139, 23 through 24. Search me, God, and know my heart. Test me and know my anxious thoughts. See if there is an offensive way in me, and lead me in the way everlasting. Thank you. Happy birthday today to Reagan Forrester, Miss Cynthia, Geraldine Scarlett, Judy-Ann Morgan, and MLA David White. Happy birthday to you all. And his twin brother, Chris.
That'd be
Yes.
a bit offensive. You didn't say that.
Yes. Today I wanted to focus a little bit on we need to ensure we invest and in our millennials and our generation Y, born between 1981 and 1996. The millennial generation is known for their strong sense of community, both on local and global scales. They normally focus on large societal needs rather than individual needs. They're the most civic-minded generation since the 1930s and 40s. They are highly educated, self-confident, tech-savvy, and ambitious. This generation, ladies and gents, are the future leaders of the Cayman Islands. Let's ensure they're not forgotten and also to recover from this pandemic. As I've said before, a Benjamin Franklin quote, "Tell me and I forget. Teach me and I remember. Involve me and I learn." When I say I'm a Christian, I'm not shouting that I'm living clean. I'm whispering I was lost but now found and forgiven. When I say I'm a Christian, I don't speak of this with pride. I'm confessing that I stumble and need Christ to be my guide. When I say I'm a Christian, I'm not trying to be strong. I'm professing that I'm weak and need his strength to carry on. When I say I'm a Christian, I'm not claiming to be perfect. My flaws are far too visible, but God believes I'm worth it. When I say I'm a Christian, I still feel the pain and sting. I have my share of heartaches, so I call upon his name. When I say I'm a Christian, I'm not holier than thou. I'm just a simple sinner who received God somehow. Maya Angelou. Everybody is somebody, even a nobody. Firstly, I want to give you 2 quick updates today. Remind our local artists of the Artist Relief Grant. The National Gallery, in partnership with the Ministry of Culture and the private sector, are offering a one-time artist grant of $1,000 per artist. 20 grants are available on a first-come, first basis. To qualify, artists should be relying on their artwork as their primary source of income and should be experiencing significant loss of income due to the pandemic. The deadline is the 24th of July, 2020, and the form must be fully completed and signed to qualify. Artists should contact the National Gallery for more information and to apply at administration@nationalgallery.org.ky. Artists are a huge part of our storytelling heritage, so I am happy to support this great initiative. Secondly, I want to speak quickly to the subject of mosquitoes, as I've received a few queries in this regard. The mosquito creating the irritating situation felt across the island is known as the black salt marsh mosquito. The first thing to note about them is that they are not disease carrying, but we do know that they are very annoying and making life very unpleasant for many of us. In fact, they are referred to as the nuisance mosquitoes. It doesn't help that those mosquitoes are strong flyers and will travel many miles from the water in which they were produced. Females can easily fly several miles in search of blood. I want to remind the public that Mosquito Research Control Unit has been surveying and treating the production sites in emergent, flying and biting mosquitoes throughout the COVID-19 pandemic. They have done so whilst, and most importantly, ensuring that personnel and staff adhere to all proper precautions related to the risk of COVID-19 transmission. Though MRCU has tried not to allow COVID-19 to impact their service, like the rest of us, it has influenced and impacted operations to some extent. Despite limitations in the airport operation hours, the aerial team has worked closely with the airport operations to continue flying at this time. Aerial and ground operations both have been impacted by high winds this month that made spray operations impossible. Additionally, aerial operations were briefly paused due to the extreme Sahara dust situation, but resumed last Friday as dust conditions improved. I want to assure the public that MRCU is working hard to help eliminate the problem and will continue to do so. I encourage the public to wear environmentally safe mosquito repellent as well as to help to repel the mosquitoes. Also, I wanted to, as has been mentioned, further words to the Excellency and the Premier. I would like to suggest we show our appreciation and thanks to Caymanian healthcare workers by also taking a moment to clap, which will be recorded. I understand there will be a clap in the UK at 5 p.m. on Sunday. So this recording will be played on various social media channels at 5 p.m. on Sunday, so that we are clapping along with all those clapping for the NHS. I thank you and God bless.
Thank you, Minister Seymour. Thank you to all our panellists. We'll start with questions from the campus. Kayla, go ahead.
Hi, everyone. I just have a few questions today. And, you know, as restrictions ease and we all get out and about, I know a lot of people are thinking about what comes after this in September. And I'm wondering what advice we would give students who study in the US or the UK right now, if it's advisable at this time for them to consider returning to hotspot locations like the US. And if we have any advice for those young people.
Well, I don't know if I can, or whether I should try to advise parents what to do about their kids. I shouldn't call them kids, but I call my 28-year-old my kid, so don't take offense, anyone. But if it were my children, I would have them stay in Cayman at least until the end of the year and see what happened. I wouldn't send my children to the UK or the US in the current environment. You asked me, I told you.
Yeah, well, no, that's what I was wondering. And parents,
just add, I think would like to just add to that in the context of the UK. I mean, I think the UK and US situations are different. I mean, the UK is coming out of this and is getting a grip on it. Leicester is clearly an area where they've had to lock down. I think the UK is opening up and doing so in a measured way. But I agree with the Premier that it's up to parents to take their individual risks. But I mean, I wouldn't have a problem with sending my children to the UK at the present time.
And I must also caution, if I can, that you never know, there might be a surprise of a vaccine or something that comes on in the next couple months, and it depends on the situation in the U.S. if they take some aggressive measures to clear this up. So it's a wait and see really game. Really, it's fluid, and we just need to pay attention to what's going on.
Well, in the mention of the vaccine, the governor discussed research in different locations in the world earlier. What is a reasonable time frame for the public to have in mind to expect a vaccine?
I would say, I see the U.S. are saying that they'll have one by the end of the year. I'd safely say at least by January 2021 before we see any light of it, from what I've been seeing.
Yeah.
Hearing.
Jumping off of the topic of students traveling, we've seen some other Caribbean islands open up to international travelers, Jamaica, Antigua and Barbuda. Are we observing the lessons learned from those islands? Are there lessons to be learned from their experiences? And are we still hoping to welcome international travelers in September?
I think the answers are yes and yes.
Definitely, we have to pay attention. We're paying great attention to what's we don't want to reinvent any wheel. We're definitely paying attention to what's going on to us in the region and in the U.S. To definitely, we can learn from them. We see some mistakes they've made already that we won't do. And when we talk about September 1st, there's a lot of discussions going on in the Premier's ministry and Minister Hughes' ministry and otherwise, and trying and also with Danielle, in terms of trying to find methods for us to be able to open our borders in a safe way, and that there's a lot of discussion to be had as to how we do that. So there's no clear blueprint as yet as to how we open this country and what route we take.
And so I just get my questions here. I also wanted to get a quick answer from the governor about repatriation flights. You mentioned the India flight today and the air bridge to London. Are there any other repatriation flights that your office is working on right now? For example, Nicaragua, Jamaica?
We're still in close contact with Nicaragua, and we have been asked to provide all the details of the passengers who want to go to Nicaragua. So there's work going on process to try and secure that flight. But at the moment, we still do not have agreement to send a flight to Nicaragua. I think my office is involved in the BA flights, the organisation, and any negotiations with foreign governments. But a lot of the other flights, Jamaica, for example, Miami, that's sort of Cayman Airways and the travel time team.
Yeah.
Okay. All right. Thank you for that. Those are all of my questions for today.
Thank you, Kayla. We'll go to CNS next. Wendy.
Thanks for that, Caroline. Just a quick one for the governor regarding this. You did say there is no reciprocation regarding the quarantine here. I was just wondering how clear that's been made in the UK, because there are tons and tons of news reports coming out saying that British people can come on holiday now to the Cayman Islands.
Well, I don't think you've seen any of those today, Wendy. There were some a while ago. It's very clear, and we're in no doubt of what the rules are for people coming to Cayman. So I wouldn't pay too much attention to media speculation.
Okay, thank you for that. My next question is for the Premier, and it's regarding quarantine facilities. What's the situation there now? Because we've had a few calls from people who have been told, especially the Canada situation, which was apparently all sorted for people to return, about 60 people to return from Canada to here. But we're now being told that they can't necessarily come because there isn't quarantine facilities. Can you tell us what the latest is on that, and how the RFP is going, and how government envisages sorting out this problem?
I don't know if Danielle can help with this in any more detail than I can.
I knew you were going to say that.
Yeah, I only know that the RFP is out. I don't know what the results are.
Thank you very much, Mr. Premier. The RFP has been drafted and is getting finalised now. We have expanded the room capacity at the Wyndham Hotel as well as the Holiday Inn. So, yes, there's still a shortage. We do understand that a lot of people want to come back, but again, it's making sure that we get the appropriate facilities for that.
Danielle, has there been any consideration, because I think some people are concerned, some people want it to happen and others are very concerned about it, which is the idea of self-isolation for people coming back?
Lots of consideration.
There has been a lot of consideration on that. Again, we have been researching different methods for some time. I have not been involved in the latest methods. I'm not sure if Dr. John wants to talk to that, but again, it's a sort of a risk assessment. We want to make sure that we get it right. At the end of the day, you know, if by chance self-isolation at home doesn't work and we create a surge of cases here on the island after doing so well, it really is one of those things we have to balance up. And again, we're not quite there yet to make sure that the risk outweighs the actual potential harm of doing that.
Okay, thank you.
Thanks, Wendy.
I appreciate that. Sorry, let me flip over. I think that's all of my sort of quarantine questions. Oh, yes, for the Premier again, people are saying, I don't know how true this is because I haven't rang it myself because it's just been a few emails today. People are saying they're having difficulties getting through on the hotline to talk to Travel Time. Have all the numbers changed or are they staying the same? Because I'm sure last week you said they were staying the same.
The numbers to Travel Time are the same. I'm just checking my note here to see if there was a number, and I don't have one. Wendy, let me check on that for you. I'll try to get it done while the briefing is still going on. I'll just send a note out to my folk and see if we can answer it before we wind up.
Okay, great. And my last question is a nice political one that you're going to like, Mr. Premier, which is yesterday when you were in the LA, you said that the CPR people had basically denied the people a vote on the poor, whereas in actual fact, they said very, very clearly in their press release that they want a referendum on election day based on the question that was agreed during this legal process. And so therefore, it would be your administration that's responsible for setting that up. So have you given any consideration yet to holding a referendum on election day next year?
No, we won't.
Sorry?
No, we won't, Wendy.
What, you won't hold it on that day?
No, I don't know whether or not the new administration, whether that is a continuation of the one that I currently lead or some other, will want to deal with this issue. And in any event, what needs to be carefully thought about, which I don't think CPR have, if they thought about it, they certainly haven't said so, is that this referendum is specific to this project. So it is unlikely in the extreme, given all that has transpired, not just with respect to the campaign for the port or against it, but the completely changed environment that all of us are now living in. None of us know how that's going to come out at the end. It is unlikely in the extreme that you would wind up with this same project. And what I was trying to convey yesterday is that this is a dead duck. You know, from the government's perspective, you know, the surgery was successful, but the patient is dead. And so whoever takes over the next administration will have to decide whether to proceed with, essentially with a cruise industry in Cayman, and if so, on what basis. For I have always said, and I say again, we cannot expect to offer what we claim is a world-class service and have sort of almost primitive means of transporting the people here and no amenities of any consequence for them when they come ashore and when they are trying to re-embark. So this whole thing is going to have to be thought through all over again. And I think we can all safely say that this particular saga is at an end, unless, of course, they press ahead with the attempt to have it heard by the Privy Council, but that's not going to really change, I think, the practical outcome on the ground. What I am absolutely relieved about, as I said, is the point I've made to you and others over and over again, that far more important than the narrow issue that CPR focused on were the serious implications for the exercise of democracy in this country and the control or not that the elected representatives have over policy decisions. Whether that was going to remain where it ought to be, that is in the hands of the elected members of the Legislative Assembly, or whether that would become something that any judge, even a temporary judge, could jump into and decide to change the course of. And so we now have two decisions of the Court of Appeal which have told the Grand Court very, very clearly, your role is the interpretation of statute. Your role is not the making of policy, that legislative policy. That is a matter for the duly elected representatives of the Cayman Islands government. Unelected judges have no right to make those sort of legislative policies. One thing, whether the elected representatives are good, bad, or indifferent, whether you like what they've done or not done, you have a recourse to remove them. Once judges are appointed, unless they are found guilty of some very serious misfeasance, they are there for life in most, or for their, not life necessarily, but until they reach retirement. And so we really have, I think, benefited hugely from these two cases. And I do think now that going forward, all of us will understand what the respective roles are of the judiciary and the legislative branches and executive branches, branch of government, and that each of us, each branch, must respect the other and their role set out in the Constitution.
Sorry, Mr. Premier, can I just steer you back a little bit to the referendum itself? Because as I asked you, so you're saying that you are not prepared to hold a referendum on election day on what was a much more generic question that it had been agreed, I understand, during the legal process. So it could cover the principle of any cruise berthing development in Georgetown Harbour. It was generic enough. So are you saying that you're not prepared to hold that referendum on election day?
Wendy, I suggest you spend some time and read the judgment. I know it's very long, it's 41 pages.
Yeah, I have, I've read it.
Right. So you will see that the court made it very clear that this was not a generic question. They talked at length about whether or not the complaint that the government had included the enhanced cargo facilities as part of the question ought to or ought not to be part of it. This question and this referendum petition was specific to the project that was underway. The complaints were about the nature of the project and the environmental concerns that that grew up as a result of the amount of dredging, the area of dredging. Once you start thinking this through, you will understand that the whole exercise was about a specific project. And in any event, that can't bind a government going forward. That's the reason you have elections, so that each election, the people can decide on the basis of what has been said by those who are standing for election what they intend to do in terms of policy decisions. So it would be wrong at this stage in principle, and for this administration to seek to go down a particular road, dealing with a referendum on a project which there's no way at this stage we would even get started. So there'll be a fresh start following the next elections, and we'll see what the people of the Cayman Islands want, and we'll see what those who are elected decide to do. From our perspective, and certainly from mine, we're putting this behind us. We've got lots of other massive challenges to deal with, as I think all of us are very aware.
Okay, thank you. That's clear. I have no more questions, I don't think.
Thanks very
Thank
much.
you, Caroline. Yes, my questions are done.
Thank you, Wendy. We'll go to Ralph for the Caymanian Times.
Good afternoon, members of the panel. Hope you had a great week. I'm tempted to follow the line of questioning that Wendy started, but I prefer to stay on point today.
I'd rather you not. It makes the governor very uncomfortable. These briefings really are to focus on COVID
Yes.
and those issues. So anybody feel free to call me outside this to talk about these issues.
Yes, and as I was saying, I prefer to stay on point today. And so I have three questions for you, sir, and I'll make them brief as possible. The first one is, since you're now in charge of travel time, have you considered any flights, or have you discussed any flights to Roatan to bring up some of the Caymanians who are stranded down there?
Well, I haven't been involved in the nitty-gritty of the detail. I haven't heard any pleas recently for a flight to Honduras. I know there are a few people there, but I'm not sure there are enough people there to warrant a flight by Cayman Airways. Very expensive exercise.
Thank you. Okay, my second question has to do with the work permit holders. The deadline expired this past Tuesday for those to submit their applications. And I would like to know, for those work permit holders who were unable to submit new applications, or the employers unable to submit new applications, and for those whose work permits expired, and what's the next step for them going forward?
Well, it would be the same as it would be otherwise. I don't understand why people wouldn't have gotten in there was plenty of time to get in a renewal application. So if you don't renew your permit within the period that is allowed, then you have to apply for a new permit in the usual way.
Yes, and for those who have no employment and their permit have expired, what would you recommend?
Sorry, I missed the first bit of it. Those who
do not have any employment and their permits have expired. In other words, they'll be seeking time. What do you recommend at this point?
Well, I'm sure that work will work with them until it is possible for them to either get new employment or find a flight out that accommodates them, gets them to where they need to be.
Thank you. And my final question is regarding border reopening. We've tried to get a sense of those of Caymanians residents who are concerned about the timing of this border reopening. And our sense is that many people prefer that it would be delayed further. We've mentioned a date of September 1, which is about 7 weeks from now. Are the other stakeholders that would be involved in the tourism industry prepared for any reopening in the next couple of months?
Well, this is not the answer to your question, but this is one of the things that exercise our minds. Dr. Fauci, I think we all know who Dr. Fauci is, warns, this is today, that the new mutation of the virus that they are now seeing in the U.S. will speed COVID across the U.S. 53,000 new infections yesterday in the U.S. breaks the record set the day before. So, I mean, this is terrible news for us here in Cayman. 80% of our tourism is from the U.S. And of course, you know how Caymanians, not just Caymanians, and residents love Miami. So, you know, we are all suffering from massive withdrawal now. But we're not in control of that part of the piece, I'm afraid. So what we are worried about, seriously, is the introduction of, even if it's not a more virulent strain of the virus, because it doesn't seem to be killing people in the U.S. the way it was before. It is reported to be as much as 10 times more infectious than the original strain. So people are catching it far more easily. And it would change the way that things are playing out here if that were to catch a fire here. And I don't think any of us want to have to deal with that, given where we've come from and given where we are. I think we'd rather suffer with not being able to travel to the U.S. and not being able to have the benefit of that business for a little longer.
Okay, just one more question, and regarding the same thing. As we know, the slow season is normally during the next couple of months. September, some restaurants close down, and the tourist season really starts from November 15th. Do you think it wise that we should have a date such as November 1st for the reopening, and that which will give the airlines and stakeholders ample time to really plan, to really get things in place, to really get protocols in place? So what I'm asking is if you think that November 1 is a more realistic time for reopening for the country.
Well, we're obviously going to have to make that decision relatively soon, but today is the 3rd of July. So there's still a fair bit of time. So we actually have, as I announced before, we have a committee, a cross-ministerial committee that is working on a reopening plan. But no matter how good that plan is, we really can't open the borders when the virus is as rampant as it currently is, because it will mean that every flight that comes in here will be bringing some vectors of this disease, no matter how hard we try.
Thank you for
to add to
my
what
question.
Premier said,
Sorry.
The planning that is going on right now, we're planning an opening without a vaccine. So obviously we know that COVID is still alive and well. Obviously, as I said earlier, there is a lot of discussion going on as to how we can open safely. And when we do, it will be unveiled. I think the public would be happy that the amount of work that has been put in to trying to ensure that, as Premier said, we don't get that strain of COVID here amongst the Caymanian population, and to try to do everything to try to protect the luxury, I would say, of the slight strain that we've had here in Cayman. So there's some stuff we're working on. Obviously, a lot of people want to know that because a lot of people's lives depend on it. A lot of jobs depend on it. And we understand that. And the Deputy Premier is working really hard, also with the Minister of Commerce, and as Premier said, cross-ministerial. So we're Ministry of Health, Dr. Lee, CMO, they're all working hard because we understand now after July 19th, that is the real main focus of how do we open safely.
I thank you for your comments, Premier and Mr. Minister. And I would say that when I heard your comment on the results, I definitely heard the bells of joy ringing. And with that, I leave you for the weekend. Thank you, Caroline.
The bells of joy.
Thank you, Ralph. The travel seems to be, one of the top questions that's coming into us from members of the public as well. They're wanting you to share a little bit, if you can, of your insights into the reopening plan. Are you considering a phased approach of safe corridors, something that's on the table for your considerations as well?
there are all sorts of discussions. There's discussions about travel bubbles, the discussions about rapid testing, about what sort of protocols, because the truth is we really need to test the person at their place of origin. There's no point in flying them here, testing them and finding they're positive, and then what do we do with them? The plane's not going to take them back, so we're going to have to put them in some facility. And we clearly can't accommodate, hundreds of more people, and there'd be hundreds of people coming every day. So we've got to actually test them outside the Cayman Islands at their place of origin. Working out the protocols around that, essentially, you'd have to have a longer check-in time than the usual 3 hours or whatever it is. So you could do the test, get the result, get on the plane. Then you come here, and then what do we do with you? Dr. Lee he didn't tell you about it, but he's trialing one of these fancy gadgets that will send information to a central location that says, whether your temperature is spiked, whether your respiration is still okay or abnormal, triggers that would ask public health, would tell public health we need to have this person tested to see whether or not they have the disease or not. When they come, are they allowed free reign around the island, or are they, at least for a short period, only allowed within a particular? All of those kinds of things are being considered about how we can safely do this. Also, long-term residents or people who will come and stay for more than the usual 4 or 5 days, which I think is the usual range that people come for a visit. How can we get them back? Because of course they provide a greater opportunity for us to be sure about, because of the length of their time they're here, whether they are safe or not. And we'd like them to come back quickly, because they will also provide us with an opportunity to see how well this can work, rather than the hundreds of people that come once you open the borders and the commercial flights come back on a regular basis. So all of these things are being talked about and knocked around. Believe you me, government is as anxious as any hotel owner, condo owner, or small business owner to get tourism back moving. But we can't risk what we have in terms of public health in the process. I mean, I shouldn't say we can't risk. There will have to be some risks taken in any event, but they have to be risks that we believe are manageable. Not risks in saying, well, we pray and we hope. It can't be that sort of approach to it.
Well, thank you, Caroline. And I just want to add to what Premier said. A lot has been learned so far. And there's a lot of research going on behind the scenes. There's a lot, as I told you, there's a lot of discussions going on, very mature discussions going on. I'm quite satisfied with what I've seen so far and with the options that are out there on the table. And it will only get better because we still have 2 months to see what's going on around the world, next door, around in the region, to see what challenges they're having. And, with all these new discoveries going on, there's a new discovery every week. So we have the benefit of being at a very comfortable place right now in what we think can actually work with testing persons before they come to the Cayman Islands. There's guidelines as to how many days you would test a person before they actually catch a flight. And there's different methods that you can do that other countries are doing right now that we're learning from, and some very useful information out there. And I feel very comfortable that we'll be able to open, and when we do open, because of our patience in waiting until September 1st, unlike many other Caribbean and countries in the region, July 15th and July 1st and some June 15th, that we'll be able to learn a lot from what's happening in the world and I think we'll be safe to open, whether it's September 1st or October 1st, whenever it is. And I don't know the difference I know about the season. I can only tell you now that there's almost no slow season now, because many years ago, let's say 35 years ago, September, October were the slow seasons, and most airlines failed to come. They would pause their flights. Now, what you've had, I know definitely some American airlines like Delta have just started flying nonstop and never take a break. So it's like no slow season, which is a good thing for us in the Cayman Islands. So I can only say to you, it hasn't been unveiled, but there's a lot of good information that the CMO and the other teams are working on that will make the process as easy as possible, but as safe as possible for persons coming to the Cayman Islands. And once they're here, we'll also be able to monitor, in some sense, as to persons who are presenting certain symptoms, etc. So I think that's all I can say for now, but I think we're on a good track.
Thank you, Minister. My second and final question comes to us from Hurley's Media for the Premier. They're asking if you can kindly share some insight into your discussions around the 25-person limit on gatherings and whether that's something that might be relaxed in the next phase, or whether we should just start getting used to more permanent sort of caps on large-scale events.
I see Dr. Lee getting up to ready to expound on this
Dr.
issue.
Lee is showing us his chest, so we're all getting a bit hot under the collar.
I wasn't going to answer your question.
That's all right. You can go ahead. We'll ask it afterwards.
So good afternoon, everybody. This is your delight for the holiday weekend. I thought you might like to see the device that Premier was talking about. So this is what's called a bio sticker, and it's monitoring my temperature and my pulse and my breathing. It's the sort of thing we're thinking of trialing to see whether it might assist us in really being leading edge in how we monitor people that are coming to the island. So just thought you might like to see that.
Yeah, I almost had one, but I had to get the Premier's approval first.
Thank you, Dr. Lee. Could you help with the question about how long the limit on gathering to 25 would remain, and whether it would be possible to lift that in the next few weeks or?
I think so. That's difficult. As we move towards the accepting visitors to the country, as that will bring its own challenges, and the regulations may need to be changed again. So I feel we need a more comprehensive discussion to take into account that challenge associated with the gatherings, which would clearly need quite a bit of discussion. I mean, if we are just to stay as we are, I would feel we could relax that now. But yet, rather than switch and change, if we're about to accept visitors, then we may wish to actually continue some of these restrictions in order that we limit the exposure to the threat of anybody that's arriving. But if it was just in Cayman, again, things like lifting the restrictions on visiting nursing homes as well, I would consider that too. But combined with the other challenges we're going to face, I feel that needs a wider discussion.
Thank you.
Well, I know the question is going to come, so let me ask it in any event. So we're not sure when we'll reopen. Could we increase the gathering number?
I feel,
even though there'll be complaints maybe if we have to restrict it again. But yes.
I mean, I feel, yes, we're getting there. It's with a great deal of comfort we're seeing continued low rates of infection. So.
Thank you very much, both. We'll go last but not least to Radio Cayman. April, go ahead.
My questions actually are for Dr. Williams. A number of people I've spoken to had put off a lot of, well, because they had to put off medical treatments for various reasons because they weren't critical. Have you seen any increase in requests for services from HSA for medical treatment? Are we experiencing any backlogs or delays as yet? And then also, could you comment on the immunization catch-up program that we got a press release about today?
Hi, good afternoon. Yes, with the reopening of services, we have seen an increase in the number of requests for appointment, and we actually are reaching out to some of these patients. The appointment was canceled for a reason to reschedule them, both at the hospital, the primary healthcare, and the dental services. When it comes to the immunization, I said it came a press release. We are ready. We have gone through the process now of updating our national immunization records. And now we are in the process to start contacting the patients to do the catch-up. So all the public health nurses are now focusing on this. The number of COVID cases are less, so and the number of patients that we are actually doing contact tracing for COVID is less. So right now we have a little bit more time to focus more on vaccination and immunization problem, and immunization program in the Cayman Island. So the press release that came out today explain in details, or not in detail, but explain what is our plan. And we're definitely going to be able to catch up within the next month or so with all our immunization practice here in the Cayman Islands.
So for people who may have put off even requesting appointments because they're concerned, even if these are not critical matters, do you encourage them to go ahead and get in the queue to get treatment, or should they kind of give hospital officials a chance to sort of catch up?
No, they should still contact the appointment clerk, and an appointment will be made. We already started, especially in primary health care. I think I will encourage them to attend the primary care physician to get assessed and to make sure that all the chronic conditions are up to par. All the investigations that need to be done are up to date. And if they need a referral for a specialist, that will be done as well. We're trying to get back to normal. The appointment will take a little bit longer now because of the backlog and all the measures that we have in place to prevent any COVID infection. But we are trying to get back to normal. So we'll encourage the patient to contact their healthcare provider, the appointment clerk, to make an appointment now at the HSA.
Thank you so much, Dr. Samuel. And just one last question. If the Premier could speak to sort of, it's been a week since we've talked to you about this, but how do you see how things are going? You seemed positive but tired, if I were going to characterize how you sounded at the beginning of the press conference.
I don't know if you can call it tired. It's well beyond that, but it's not so much the physical tiredness, which it is a constant strain, but and it's not just this. It's the EU. It's the domestic partnerships bill. It's it's Wendy. It's all of these things. But no, I'm actually in a very, very upbeat mood about most things. Things are really going incredibly well considering all, and we're still having to work incredibly hard, but that goes with the territory. And I really believe we're going to come out of this as a much stronger jurisdiction than we were before. As I've said before, I mean, I think some serious thinking is going to have to go on about a number of things. The cruise industry is one among them. Tourism generally. How do we manage? We don't know how long this crisis is going to go on, because even after you open the borders, it can't be life as normal as long as the virus continues to be a major threat. So a great deal of thinking is going on, and we still have to manage all the other business of government as well. So yeah, there's a reason why I might appear tired, but I am very positive and very upbeat. I have been for the last couple of weeks, even after the fact they kept me at the alley until 11 o'clock last night. I'm still feeling good.
Thank you very much, sir. I appreciate it.
Thank you, April. Thank you to all members of the media. Any closing thoughts, Minister?
I just wanted to say, as as part of our strategy, we have some innovative technology. As you saw, Dr. Lee exposed himself there. Sorry, removed the shirt. But we think that this can be a key part of developing a safe and thoughtful approach, much better than most in the region. So this will be announced pretty soon. Thank you.
All right, we'll leave it there then. Thank you very much for joining us this afternoon. A reminder, you can check out gov.ky/coronavirus and all of our social media channels for the latest information. There's no scheduled press briefing next week, but we'll bring you any details as and when we need to. And in the meantime, stay tuned to check out those latest regional and global coronavirus statistics. Thank you.